Hello friends, today we'll discuss about breast surgery procedure codes. These CPT codes are mainly used for treatment of breast cancer. So I will request you to please check out this video till the end, because in between if you miss some procedure codes or some coding tips, you might get confusion in coding these CPT codes while coding a medical report. So if when a patient is diagnosed with a breast cancer, the next process is weighing the surgical and medical option for treating the disease. So once it's diagnosed with a breast cancer, so depending on whether it is benign or a malignant, the procedure will depend. So we'll check out what are the CPT codes used for this breast surgery codes. The physician will discuss with the patient for the best treatment option depending on the type of cancer, the stage, the size, sensitivity to hormones, or if it has metastasized. So here all these cases are mainly for the benign or the malignant neoplasm depending on the severity of the breast cancer. So the CPT codes used for breast neoplasm treatment. So the treatment options are considered based on the stage and may consist of surgical options. So such as like excision of breast lesion, and the CPT codes are 19120, 19125, lumpectomy, removing a region of breast mass or a lump from breast. So the CPT codes are 19301, 19302, and lumpectomy also called as partial mastectomy. So this is the description of CPT code 19301 and 19302. 19302 includes partial mastectomy with axillary lymphadenectomy. Some axillary lymph nodes are also removed. Now coming to mastectomy is actually the removal of entire breast. We'll check out later. So first check out the CPT codes used for mastectomy. So first one is 19303, simple and complete. 19305, radical mastectomy, including pectoral muscle, axillary lymph nodes. So here in 19301, the surgeon removes a single lump or portion of the breast tissue. So 19301 is a removal of portion of breast tissue, which is actually partial mastectomy and also a called lumpectomy. Whereas in 19302, a single lump of portion of breast tissue is removed and lymph nodes between the pectoral major and minor muscles and in the axilla are removed through a separate incision. So here along with the lump, lymph nodes are also removed. That is why in 19302 it is mentioned as with axillary lymphadenectomy. Adenectomy is removal of lymph nodes. So in 19303, a simple complete surgery to remove the entire breast or both breast, mastectomy, and 19305, a radical mastectomy, removal of breast, underarms, and underarm lymph nodes and chest muscle is done in 19303. So this is the main region where you have to check the description for coding 19301, 19302, and 19303. 19301 is partial mastectomy, 19302 is partial mastectomy with axillary lymphadenectomy, and in 19303 is mastectomy simple and complete. Now this is the difference you can see in lumpectomy and mastectomy. In lumpectomy, only a small region of the breast is removed, and in mastectomy you can see the whole breast is removed along with some lymph nodes, axillary lymph nodes, depending on the severity of the disease. Now come to coding guidelines. Some coding guidelines may be like for coders may be confused, like for coding CPT code 19120 and 19301 can be confused because the key of choosing the correct CPT code is the intent of the procedure, the tissue involved, and the diagnosis. So cancer is not always a reason to code the right CPT code 19301. Consider what is being excised. For example, in 9301, the surgeon will take a margin or rim of healthy tissue. The intent, of course, is to capture the mass within the breast tissue at the area of concern, but remove or additional structure may be refined. If the intent is to remove the lump and the lymph nodes between the pectoral major and pectoralis minor muscle, in addition to the nodes in the axilla, this would be called would be a complete axillary lymph excision reported with CPT code 19302. So in 19301, the surgeon will take a margin or a rim of healthy tissue along with, just to remove the abnormal mass, it will also the surgeon will also remove some healthy tissue to treat the whole surface completely for removing the breast neoplasm. But in 19302, as we have checked here, we will code some along with partial mastectomy, there will be some axillary lymph nodes also removed in 19302. So this is the main difference between 19301 and 19302, and please do not get confused with 19120 along with 19301 here. Mastectomy, if you see the mastectomy, there are different types of mastectomy: total mastectomy, double mastectomy, modified radical mastectomy, and radical mastectomy. So mastectomy generally is removal of whole breast. Depending on these four procedures, the whole breast is treated to remove the breast neoplasm. So here you see in mastectomy involves a complete removal of all breast tissue. Type of mastectomy procedures are total mastectomy, double mastectomy, nipple sparing mastectomy, and radical mastectomy. A complete mastectomy involves the entire breast and not just a lump or a surrounding tissue. Like in lumpectomy, only a lump or a surrounding tissue or a abnormal mass will be removed from the breast. But in complete mastectomy, it involves the entire breast, not a piece of tissue or a lump. So in mastectomy, complete breast is removed to treat the breast cancer. In partial mastectomy, a large amount of breast tissue and some skin is removed. In complete mastectomy, entire breast is removed, but lymph nodes and surrounding muscles are spared. So only in simple mastectomy, lymph nodes are spared, but in complete mastectomy, I think everything they will remove just to treat the breast neoplasm completely. So this is the end of this slide. Please do subscribe to my channel if you like the video, and do share it. Thank you for watching the video. Thank you again.